Kim Kardashian has long been on the record talking about her psoriasis.
It's not ringworm. Khloé was off. But it's psoriasis.
Psoriasis? I cannot have psoriasis. When the doctor tells me I have psoriasis, I have heard of it before because my mom has always had it. But, you know, my mom didn't have like red flaky dots all over her. I'm not gonna get it on my face, am I?
In today's video, you're gonna see what psoriasis looks like, what kind of other tissues in the body it can affect. We're gonna talk about the things that cause psoriasis to flare for some people, and I'm gonna give you an overview of all of the treatment options available. Let's dive in.
How crazy is my psoriasis right now, guys?
She's got a large plaque of psoriasis on her legs.
My leg. I don't know what's happening. But I gotta figure this out. This is crazy. I usually just have this spot, but now I can tell it's going down my leg and up my leg. And all up
Starting to spread.
thigh, so I just know it's time to figure this out.
What we see here is what is called a plaque of psoriasis. Psoriasis is when the skin cells are multiplying so quickly that they are building up before they have time to shed off of the skin. These can lead large, rough plaques with what we call a silvery scale. Hers have not become too scaly yet because this is a more early lesion of psoriasis that she's probably been treating intermittently. When you see all of that redness, that's because there's increased blood flow in the skin and a ton of white blood cells or inflammation underneath the skin. She talks about how itchy this is, and for some people, psoriasis is incredibly itchy, and the truth is it can affect you anywhere on the body. The most common areas are going to be the elbows, the knees, the backside, and the scalp. Some people will get it on their hands and their feet. She's got it on her legs, as you can see. One of the unique features of psoriasis is something that we call the Kebner phenomenon. The Kebner phenomenon occurs when you get an injury of some kind that the immune system responds to fix the injury, but a plaque of psoriasis will develop in that area. So if you're getting bumped and scraped on your legs, that could cause psoriasis to start to develop in that area. We will spend more time talking about some of the triggers, including stress, and Kim Kardashian, with her former husband, has some reason to be stressed. But let's look at how Kim is treating her psoriasis.
Okay, so if you want to see what I do to get a little bit of relief, I put product.
So she just says she puts product on and then wraps her leg in saran wrap.
This spot. And I sleep in it, and I saran wrap it.
And so she sleeps with the saran wrap on her leg.
And I just rub it in. This is one time, and you saw how crazy and dark this spot was.
Significantly better in just one night of sleeping with saran wrap.
And look at how much better it is. That's overnight.
Overnight.
Saran wrapping it. Is that not insane?
So in this video, Kim just explains that she's putting product on the skin, but she doesn't tell us what the product is. As a dermatologist, I can tell you what I think the product is, and the most common thing that we will use for patients is topical corticosteroids. Over the counter, you can buy something like hydrocortisone, but we will prescribe much stronger steroids to help limit the inflammation in the skin, and most of the time they work really well. The most common prescriptions would be things like clobetasol cream, fluocinolone, betamethasone, or maybe triamcinolone, which is the most commonly prescribed steroid. She's doing something called occlusion therapy, where when you put that steroid on the skin and you wrap it with saran wrap, it prevents that from evaporating. It helps to push the steroid into the skin with better efficacy. Occlusion therapy is a nuisance though. You can see putting saran wrap on your skin, trying to sleep with that would not be the most comfortable thing, but it significantly improves the effectiveness of the topical steroid. Topical corticosteroids come with some of their own risks, however, and I've talked about those on other videos. Things like topical steroid withdrawal, although very uncommon, is a real concern. So we are cautious with how we use steroids, and later in the video, I'm going to talk about all of the new advances in the treatment of psoriasis. And yes, we're going to get into some of the holistic stuff too. One thing you should know about psoriasis is it doesn't just affect the skin. In this next video clip, we're going to see Kim talking about how the psoriasis is also affecting her joints.
I remember that's when I first met Dr. Wallace.
Your hands were swollen.
Yeah, and I went to bed one night. My phone was by the side of my bed. I never check my phone at night, ever, and I never used the restroom in the middle of the night. But I got up to use the restroom, couldn't go back to bed, so I grabbed my phone. And I couldn't really pick up my phone. It hurt so much to use my hands.
Rapid
that
development
night. I thought,
of joint
I must
pain.
have slept on my hand and it's a little numb or something. And I went back to bed, woke up the next day, it was still like that. And I remember I was doing Jimmy Kimmel and he was in Vegas. And I was like, my ankles were really hurting. And it was just my joints. And I thought, what is this?
On this podcast, Kim Kardashian is appearing with her rheumatologist. A rheumatologist is a specialist in the immune system, in immunology, and the way that autoimmune diseases and many inflammatory conditions affect the body, particularly the joints and the internal organs. About 30% of people that get psoriasis on their skin will develop what is called psoriatic arthritis. And the inflammation that you see on the skin also starts to occur in the joints. It's common on the hands, the ankles, the knees, the lower back hips, the neck. And psoriasis is not fun on the skin, but psoriatic arthritis can actually be disfiguring to the joints. It can actually eat away the joints and lead to permanent damage to the joints. And there's no topical cream, no steroid or anything that's going to prevent the joint damage. And that's when we typically need to put medicines inside the body to help mitigate the effects of that inflammation. Now, Kim Kardashian is not the only member of her family that has psoriasis. She talks about how her mom, Kris Jenner, has also suffered from psoriasis, but Kris has not been as open about it as Kim Kardashian has. I'm about to show you a video where Kylie Jenner may also have psoriasis.
Wait a minute, Kylie. What is on your belly?
What?
Do you have psoriasis?
No, what?
Kylie?
Oh, this right here. Do I?
Get over here. It's psoriasis. Bible. You guys
Bible.
are such twins. You have psoriasis! Welcome to the club!
Now, as far as I know, Kylie has not gone on the record and talked about her psoriasis, and Kim is not a doctor, and although briefly what we can see in that clip could be psoriasis, I don't know that we can just trust Kim's diagnosis of that. But what you do see here is that camaraderie that can happen when you find somebody that you can share the experience with. Not in a bad way, but in a way that you can be supportive of each other. And that's why when you have psoriasis, it's important to have social support, support of your medical team, your family, and there are organizations like the National Psoriasis Foundation that you can connect with to be part of community groups, to talk about your psoriasis, to fundraise for the research of psoriasis, and that is an important thing. You don't want to feel like you're alone when you're suffering from some type of skin condition. Now, there's a lot of misinformation online about what causes psoriasis, and we're going to touch on that a little bit. There are certain genetic predispositions. So in this case where Kris Jenner has psoriasis, it would be more likely for her children to also have psoriasis, and that's why we see Kim Kardashian with it. There's certain genetic mutations that don't guarantee that you're going to get psoriasis, but they certainly increase the likelihood. And then many times there's an environmental trigger or stress, something that causes it to come out. And once that psoriasis develops on the skin, it can be a self-perpetuating cycle. Some of the most common triggers would be red meats for some people, dairy products for other people, gluten, although you don't have necessarily a gluten allergy, you may have a gluten sensitivity. So wheat, rye, barley, things that have gluten in them will cause inflammation in some people that can manifest as psoriasis. In some individuals, citrus fruits may be a trigger, and in others, nightshade vegetables could also be a trigger. So if you are suffering from psoriasis, it can be beneficial to look at your diet and consider doing an elimination of categories of foods and seeing if the skin condition improves. Two other categories that you should be aware of are just things that are highly processed and have added sugars. Sugar is, especially at higher doses, very inflammatory in the body, and when you have inflammation and you have a predisposition for psoriasis, you might notice that your skin condition becomes worse. And the last thing that I'll say about the things you put inside your body are alcohol. alcohol is absolutely inflammatory, and for some people will cause a worsening of their psoriasis and an increase in the pain of their psoriatic arthritis. Now, foods aren't the only thing we put in our body that could cause psoriasis to get worse. There are certain medications, some of them are pretty commonly prescribed, that also can cause psoriasis to develop. And some of these people will have medication-induced or drug-related psoriasis. And that means that when they stop taking the medication, the psoriasis will go away. The drug or the metabolites of the drug are triggering that immune response. Some of the most common medications are going to be things like beta blockers, things like propranolol, metoprolol. These are commonly used as blood pressure medications. Lithium, one of the most notorious for causing psoriasis to flare up. Lithium is commonly used in the treatment of bipolar disorder. Anti-malarial medications like hydroxychloroquine will cause psoriasis in certain individuals. We use anti-malarial medications like hydroxychloroquine and chloroquine in the treatment of many autoimmune and autoinflammatory conditions, but for some people, it may cause psoriasis. Other classes of medication can include ACE inhibitors. These are also blood pressure medications, and NSAIDs, non-steroidal anti-inflammatory medications like naproxen or ibuprofen. So if you are commonly taking ibuprofen or naproxen, Aleve, to help with your joint pain, it may be the thing that's actually causing it to get worse if you have psoriasis or psoriatic arthritis. Certain classes of antibiotics like tetracycline, doxycycline, minocycline can lead to psoriasis in some individuals, and then paradoxically, things like interferons and TNF-alpha inhibitors, these would be medications like Humira and Enbrel, which we commonly use to treat psoriasis, but sometimes we're using these for other conditions like inflammatory bowel disease, and the patient will develop psoriasis. It's called paradoxical psoriasis, and sometimes it doesn't make sense because it should be a drug to treat psoriasis, and it makes it worse in some individuals. The other triggers that we should talk about before moving on to all of the treatment options available are the behavior and lifestyle factors. Now, we've talked about foods and alcohol, and to a degree that is behavior and lifestyle factors, but chronic stress is another thing that will cause psoriasis to get worse. When you are chronically stressed, you have increased steroids in your body, corticosteroids. And yes, we use steroids topically to treat psoriasis, but when your body is producing more cortisol, you can actually have a decreased function of your immune system. And if you have an imbalance there, you could notice that your psoriasis gets worse. And the truth is that almost any skin disease can get worse under stress, whether it's acute or chronic stress. Going right along with that would be poor sleep, because that is in and of itself kind of a stressful condition. Your body is not having the time it needs to rest, recover, and rebuild if you're not getting enough sleep. So sleep hygiene, basic minimum things you should do is try to go to bed at the same time, wake up at the same time, try to avoid nighttime interruptions when possible, and just keep on that schedule even through the weekends. You don't want to be sleeping in for 3-4 hours longer than you do during the week, because that does throw off your circadian rhythm. Consistent, good sleep will help improve most skin conditions. Smoking and obesity are also related to flares of psoriasis, and so if you do smoke, cutting back or preferably eliminating smoking can help to improve your skin, because your whole body health is going to improve. And then obesity, we do see that it's kind of a self-defeating cycle, because more people with psoriasis have overweight and obese conditions, and their psoriasis gets worse because the fat cells produce pro-inflammatory cytokines or chemicals in the body that promote inflammation. And so it's kind of a which came first, the chicken or the egg type of thing here, but it is more common for people with psoriasis to be overweight or obese. So lifestyle factors like improving exercise, improving the quality of your diet, and losing weight can help to make your psoriasis better. We talked briefly about the Kebner phenomenon, and that is injuries in the skin, but things like getting tattoos and piercings could also lead to the development of psoriasis. And I have seen this in the clinic where somebody has a predisposition to psoriasis, they get a new tattoo, they think they have an infection or a reaction to the tattoo, and it's really just psoriasis developing there. And all of that inflammation will make it so the tattoo doesn't take as well. It looks blurry, it looks bad. So if you do have psoriasis, you have to be super careful if you're getting tattoos or piercings. And the last lifestyle factor, I guess, that we could touch on is infections. If you get a strep throat or another strep infection, there is an immune reaction that can happen inside the body that causes psoriasis to flare. This commonly appears as something called guttate psoriasis, where you have lots of little raindrop-like spots of psoriasis all over the body. Sometimes this is a temporary phenomenon. After your body clears the infection, the psoriasis will go away, and sometimes the psoriasis is there to stay and needs more intense treatment. Speaking of treatment, let's move on to all of the treatment options that are available if you have psoriasis. We have touched on topical steroids. They are a mainstay of psoriasis treatment, and when used appropriately, they can be very effective. But they don't solve the underlying problem, and they don't keep psoriasis away. Most people that use topical steroids will notice that when they stop using them, after a week or two, the patches of psoriasis are starting to come back. Oftentimes my patients will use these steroid creams for a short period of time, get the plaques to go away, and then we have them use that intermittently, like once or twice a week, on those areas to keep the psoriasis from coming back without overexposing them to steroids. Over the last few years, we've had a number of other topical medications approved for psoriasis that do not contain any steroids, and when possible, I like to use these on my patients. These would be medicines like Protopic and Elidel. They fall in a class of medications called topical calcineurin inhibitors. They are incredibly safe. They have very low rates of side effects. They don't predispose you to adrenal suppression or thinning of the skin the way that topical steroids do. They are generic now, and I use them frequently in my patients, especially if they're developing psoriasis in the groin or on the face. Over the last 2 years, we've also had the approval of a medication called Zoryve, which is a phosphodiesterase inhibitor. It's anti-inflammatory and steroid-free. It's a cream that can be used to treat psoriasis on the skin. And then another medication called Vtama, which works through multiple different pathways, is steroid-free, and can be used until that plaque goes away. One of the benefits I like of Vtama is that in their clinical trials, they showed that for some patients who used Vtama to get their plaques to go away, they stayed away without treatment for up to 4 months. So if you are considering topical therapy for the treatment of your psoriasis, discuss those options with your dermatologist and find what is right for you. Don't be afraid of topical steroids, but have a discussion about how to use them appropriately, and if you are able to, I like to use the steroid-free option. One of the things that Kim Kardashian has caught some flack for is the fact that she has a tanning bed in her house. So let's talk about phototherapy for the treatment of psoriasis. Tanning beds use UVA wavelengths of light, and they usually are going to make you tan. They also can contribute to the aging of the skin. In the clinic, we use UVB light to treat many different skin conditions, including psoriasis. When you are exposed to narrowband UVB light, and in some cases UVA through tanning beds, we will see a slight suppression of the immune system in the skin, but not the internal side effects of immune suppression, and that can be incredibly beneficial for some people with psoriasis. I have so many patients that have flares of psoriasis over the winter, and they say it usually goes away in the summer when I start getting more sunlight. So that is something you have to balance a little bit, because chronic sun exposure can increase your risk for skin cancer. But phototherapy, whether it's through UVB light, through an excimer laser, or even through a tanning bed, although I'm not recommending that, can be helpful for psoriasis. And phototherapy has been around for a long time, and it usually is quite effective. Jumping into the oral medications for psoriasis, the most commonly prescribed things in historical context are going to be methotrexate. This is an immune suppressive antimetabolite type of medication. Sometimes it's used in chemotherapy, and it gets kind of a scary reputation because of that, but we still use methotrexate in a lot of rheumatology and dermatology conditions. With appropriate laboratory monitoring, it can be very safe, and patients can do quite well on it. But overall, in my opinion, the data on methotrexate versus the risks, I prefer to use other medications, but the challenge is that many of the newer medications with better safety profiles are brand name only and tend to be very expensive. These are going to be medications like Otezla. This is a phosphodiesterase inhibitor, similar to the Zoryve cream, but it's taken in a pill form, 30 milligrams twice a day, suppresses the inflammation, and it is approved for both the skin and the joint impacts of psoriasis. The next oral medication is something called Sotyktu. This is a TYK inhibitor, which is an inflammatory pathway in the body, and by suppressing that, we do see improvements in psoriasis and psoriatic arthritis. Transitioning out of the oral medications, we're going to get into the injectable medications. These are biologic medications that are delivered by injection into the body, and they suppress different parts of the immune system. The older versions are going to be things like infliximab, Enbrel, and Humira. And then we also have developed something called Cimzia, which are all in this class of medications called TNF-alpha inhibitors. TNF, or tumor necrosis factor alpha, is an inflammatory pathway in the body that contributes to many autoinflammatory and autoimmune conditions in the body, things like psoriasis, rheumatoid arthritis, inflammatory bowel disease, including ulcerative colitis and Crohn's disease. All can be treated with these TNF alpha inhibitors. They are all given either by infusion through an IV in the case of infliximab, or by injection into the body in the thigh or the stomach. All of the companies now have auto-injector pens. They deliver them directly to your house, making it very easy to administer. The dosing schedules are going to be all over the map for these. Sometimes it's an infusion every month or two. Sometimes it's an injection every week in the case of Enbrel, every 2 weeks in the case of Humira, or every 2 weeks in the case of Cimzia. Cimzia has one added benefit, is that it is pregnancy category B. So if you are expecting or think you may become pregnant while you are being treated for psoriasis, Cimzia does not cross the placenta and has been shown to be safe in pregnancy. The next class of medications are going to be things called interleukin-17 inhibitors. And this is a different inflammatory pathway. And these medications, in my opinion, got a little bit better at treating psoriasis and the arthritis associated with psoriasis, and they have different side effect risks. This is going to be things like Taltz. Taltz is given once a month. Cosentyx is also given once a month, and these target interleukin-17 that is circulating in the body, and they bind to it before that it can impact and cause inflammation in the skin. Then there are things like brodalumab, or Siliq is the brand name, and then we have brodalumab or Siliq and Bimzelx. These are interleukin-17 receptor inhibitors. So if you think about the interleukin-17 as a chemical going through the blood, Cosentyx and Taltz will bind to it in the blood, whereas Siliq and Bimzelx bind to the receptor so that the interleukin-17 can't go impact that and lead to the inflammation. Interleukin-17 inhibitors, I think, improve the treatment of psoriasis and psoriatic arthritis, but they can increase your risk of fungal infections, and if you have a predisposition to ulcerative colitis or Crohn's disease, they could lead to a flare. So that is something you should talk about with your doctor. The last class of medications that we're going to touch on are things called interleukin-23 inhibitors. Interleukin-23 is another one of those chemicals that's circulating around the bloodstream that can lead to inflammation when it binds to its receptor, and there's 4 medications in this category. These are going to be medications like Tremfya, Skyrizi, Ilumya, and Stelara. They all act on the interleukin-23 chemical, and they have generally a really convenient dosing schedule. For some of these, it's an injection every 2 months, and for some, it's an injection every 3 months. So the data on them is generally very good in all of these medications, and the injections can be as few as 4 times a year. Now, I'm not trying to sell you on any of these, but just give you the information so you can have a more informed conversation with your doctor. Most of these are approved to treat both the skin and the joints, but they come at significant cost, whether to you or to the healthcare system, to your insurance company. Most of the time when we use these in our patients are able to enroll in prescription assistance programs, or they are on formulary with their insurance plan so that their out-of-pocket expense can be anywhere from $0 to $25. But if you don't have good prescription coverage, or your medication is not on your formulary and you have to pay cash for these, it's usually cost prohibitive, sometimes $100,000 a year or more. I promised we'd talk about some of the holistic options as well. Now, diet modification is probably one of the lowest hanging fruits that you can do. If you notice that there's a particular category of food that leads to a flare of your psoriasis, avoiding that is going to be excellent. Now, let's talk about the gut bacteria, the gut lining. If you have leaky gut or you have an imbalance in your gut microbiome, taking high quality probiotics can be a good way to help improve the microbiome of the gut and thereby decrease inflammation in the body. Now, there are tests that can be done through certain labs to look at your gut microbiome and your gut barrier function, but these are not something that every physician is comfortable ordering. It's something that I'm starting to offer to my patients so that we can then identify and then correct specific imbalances rather than just blanket putting people on a million different supplements. In general, if you have a healthy gut barrier, a gut lining, and a gut microbiome, you'll have less inflammation in the body, less brain fog, and other just inflammatory conditions. So you'll feel better, you'll look better, and you're just going to have a more productive and happy life. Avoiding alcohol is key if you have psoriasis. Getting good sleep is also key. I talk to my patients about supplements as well. So we did mention probiotics. Vitamin D can be a helpful supplement, especially if you're not getting enough sun exposure. And again, I'm a dermatologist, so I'm very cautious about how I recommend sun exposure. Anti-inflammatory supplements like turmeric or curcumin and quercetin are things that I also recommend to my patients in certain circumstances. The truth is that there's no one-size-fits-all solution for psoriasis. For everybody, it's not a gut imbalance. It's not a Skyrizi deficiency. There's things that work well for some people that fit into their lifestyle. And if you're on a medication that's working for you, you're able to access the medication, you're not experiencing big side effects from it, then I would encourage you to stay on it. And if you want to make a change because either you're not happy with the treatment, it's not working well for you, have a conversation that's informed with your dermatologist or your rheumatologist to determine what is best for you. I'm appreciative of Kim Kardashian being willing to share her psoriasis journey on social media. We don't know all of the therapies that she's taking, but hopefully she is getting the care that's making her skin look better and, importantly, her joints to feel better so she doesn't end up with permanent joint damage. Guys, thank you so much for tuning into this video. Let me know what other celebrities you'd like me to talk about their skin conditions or other things that we should be addressing here on the channel. I appreciate your time, and I'll see you guys on the next episode.